On the occasion of the 25th anniversary of the Department of Surgery of Zamboanga City Medical Center, I'd like to extend my felicitations and congratulations to the current department staff led by Dr. Joji Macrohon Sese, as well as the previous chairs, Drs. Tony Feliciano, Alex Cirillo, Paterno Cabrera, Pab Buak, and others whom I cannot remember now, who were responsible for getting the accreditation of the training program from the Philippine College of Surgeons in 1996, and subsequently from the Philippine Society of General Surgeons. I guess the 25-year celebration today is based on getting the accreditation. Thus, we are celebrating 25 years of formal training program in general surgery in the Department of Surgery. I was asked by Dr. Joji Macrohon Sese to give an inspirational message to the department on this occasion because, as she told me, I played a big part in the history. For this invitation, I thank Joji for the honor and recognition. Briefly, in 1991, I started the structured distance education on general surgery for the department when there was difficulty getting an accreditation because of lack of GS diplomates in the city. There were only 2 GS diplomates at that time, Dr. Tony Feliciano and Dr. Alex Cirillo. The requirement was at least 3 diplomates. Tony, Alex, and I tried coming out with a structured distance training program, hoping that the graduates we would produce would be allowed by the PCS and the PBS, or Philippine Board of Surgery, to take the PBS exam. If 1 or 2 passed, there would be at least an additional diplomate that will fulfill the requirements of the accreditation. There were about 7 graduates in 1996 who completed this structured distance education program and who had the potential to become PBS diplomates if given the chance. Unfortunately, in 1996, the PCS and PBS did not allow such an arrangement. Fortunately, Dr. Paterno Cabrera, who completed his surgical residency in Manila, came to Zamboanga City to practice. Thus, with 3 PBS diplomates, the Department of Surgery got its first accreditation from PCS in 1996. 25th anniversary means 2 things to me in relation to my short inspirational message. 1, 25th anniversary means 25 years of development after establishment and going into maturity. By this time, I'm sure the department should have or already have a management system, both in governance and in general surgery training program. My advice is just to follow the ISO processes. I know, for one, that the Zamboanga City Medical Center is already ISO certified. And 2, to use the detailed and clear-cut checklist on the PSGS on accreditation as a guide and fulfill all the requirements to the letter. This will ensure maintenance of your accreditation to infinity and beyond. Second, 25th anniversary also means 25 years have passed and have evolved in the practice of surgery. Many changes have occurred since 1991 when I started teaching in your department, and since 1996 when you first got your accreditation. There are a lot of changes in terms of medical surgical technology, surgical techniques, medical surgical equipment, surgical practice guidelines, etc. Although it is nice to keep up with the new trends, my simple overall advice consists of the following. While you develop your surgical skills along the newer trends, like laparoscopic or minimally invasive surgery, always maintain 3 surgical, patient care-centered foundational principles, which I will expound below. First foundational principle, the rational patient management processes in problem solving and decision making, which I have taught before and are still applicable today. Some of you are familiar with these processes. If you don't, ask Dr. Alex Cirillo or Google it or even message me. There is the motherhood or baseline clinical practice guidelines for all patients, whether surgical or non-surgical. There are 2 things that I like to emphasize here today. First, always state to yourself and to the patients your primary diagnosis after each medical assessment and include the degree of certainty and use it as a take-off point or take-off for the problem solving and decision making. A lot of physicians and surgeons don't state their primary diagnosis and degree of certainty, as a result of which they do shotgun diagnostic test and no definite treatment plan. Second, always advise and explain clearly and professionally to the patients and relatives your diagnosis, options and plans of management, prognosis, outcomes of treatment, etc. A lot of surgeons don't do this, as a result of which there are a lot of dissatisfied patients and relatives with a lot of misunderstandings and potential for medical legal suit. Second foundational principle, you may know how to operate, but always remember this adage in differentiating an excellent surgeon from a good and a poor surgeon. A good surgeon knows how to operate. A better surgeon knows when to operate. And the best surgeon knows when not to operate. The third foundational principle, you may know how to operate well and utilize the patient management processes, but always maintain a compassionate mind and spirit for all your patients. To say that you are a compassionate surgeon, you must have the emotion that feels in response to the suffering of your patients, whatever types, both physically and financially. And this emotion should or will motivate within you a desire to help the patients in whatever way, big or small, including financially. Act compassionately. Be known as a compassionate surgeon. A lot of patients will like you. On that note, I end my inspirational message with the hope that I have fulfilled Georgie's assignment to me, and I also hope that my advice will be useful inputs in planning the future direction of the department, which will be spelled out by Joji. Again, congratulations on your 25th anniversary and more power to you. Thank you very much.